The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live. I'm Shannon Penrod and we're coming to you live from the Warner Center in Woodland Hills, California. We're in Tower 1, the new home for the Center for Autism and Related Disorders headquarters. It is also the new home of Autism Live. What you're seeing right now, if you're used to the show, we're not in our brand new spanking fabulous studio yet. It's being built on the 18th floor. We're joining you from the 19th floor conference room. We appreciate CARD for lending us this space. We've been referring to this as Autism Live Light. Our lighting is a little different, our set is a little different, but we didn't want to be off the air that long. We know that what's important is joining you, hearing what you have to say, and getting information to you. So we didn't want to put pause on that for too long. But we're very excited. Be watching on Facebook to see how our new studio is coming along. Now today is Wednesday, and there's a lot of very interesting things about this week. First of all, you may have noticed that we weren't here with you yesterday. We're going to tell the story of why a little bit later when we have Nancy Alspaugh-Jackson join us for Let's Talk Autism with Shannon and Nancy. You'll find it semi-hilarious, I think. Not so much, maybe. No, I don't know. But I do want to say that we had a wonderful guest who was lined up to be with us yesterday. He is actually going to be with us tomorrow. So we've got an incredible show lined up for you tomorrow. But today is Wednesday, and you know I love Wednesdays for a couple of different reasons. The first one is that we have an opportunity normally to sit down with Dr. Doreen Granpeesheh, and she answers your questions live during the show. Well, unfortunately, this week, Dr. Doreen Granpeesheh has been called away to business. In fact, she's in Washington, D.C. right now, a place where we appreciate her having the opportunity to speak with officials about a lot of things that are very important to all of us. I know for a fact, though, that this morning she's getting a wonderful opportunity to tour the facilities at the CARD Academy that it is in Virginia. And we want to give a big shout out to everyone at the CARD Academy there and say how lucky you are that you get to be with her today. For those of you who are watching, though, you don't get to lose out. We're going to play for you. A little while back, we had Dr. Granpeesheh do a two-part series for us that we referred to as the Anxiety Show. So many of you will write in and talk about different places that anxiety touches your life and touches your children's lives, touches your teenagers and young adults' lives, and it's a constant concern in our community, the autism community. So in just a few minutes, we're going to replay the first segment of the Anxiety Show where she talks about how this now fits in with a diagnosis for autism. I think you'll find it really, really informative. We're going to play for you the second half of that next week, and then the week after that, Dr. Granpeesheh will be joining us again. And let me just say, we might have a very exciting guest to join us on that day, the 20th, as well, to make up for not having had Dr. Granpeesheh live for these 2 weeks. But it is important that from time to time, she, being the visionary that she is in the field of autism, we need to let her go and do the things that she needs to do to let the rest of the world know what she knows. I do want to start this show by reminding you that we will be live again in the second hour with Nancy Alspaugh-Jackson. She will be here with me. We've got a bunch of really interesting news stories for you, and then we have a very special guest. Ryan Judd from the Rhythm Tree is going to be with us, and he's going to be talking about what he does and how he incorporates music into a program to help individuals with special needs to feel self-esteem and to get to that progress that we always talk about here on the show. I think you'll find it really, really interesting. But Calby's going to show you some of the different ways that you guys can still connect with us, some of the different ways that you can be watching the show. While he does that, I want to remind you that our homepage is autism-live.com. Please check out all the things that are on that page. I really want to draw your attention to the blog that we have right now that talks about the free parent training from IBT, the Institute for Behavioral Training. We had brought news to you last week that they were going to extend. Right now on the blog it says you have till May 1st, and I'm telling you, you actually have till May 8th. So you have till Friday to sign up for that training. It's free training. Follow the link that is in the blog and you'll be able to sign up. Then you will have 6 months, my friends, to be able to watch those videos and help to educate yourself as to all the things that you can do to reach that progress that we're all looking for. I really want to urge you to please sign up for that, and then please tell everyone you know, every parent that you know with autism could use this, and it's free. So please go and register for that. Also want to remind you, you can be sending questions in on the live feature, although we will not be asking any questions of Dr. Granpeesheh live on the show. We will bank those questions for another show. All right, I think if we're ready, Kelby, it is time. Let's join Ask Dr. Doreen for part 1 of the Anxiety Show.
We're going to be talking about anxiety and obsessive-compulsive disorder, which now has a new name, and comorbidities that they have. In other words, similarities that they have or commonalities that they have with autism spectrum disorders. So as I've said before on this show, in May of this year, we had the new diagnostic manual come out, right? DSM-5, Diagnostic and Statistical Manual of Mental Disorders, number 5. And up till May, we had the DSM-4, and the DSM-4 was, very straightforward in terms of how we defined anxiety. So I've kind of put that on the screen first because I want people to be able to see that in DSM-4, what we had was basically, 7 disorders that were listed under the heading of anxiety. There was a chapter called basically anxiety disorders, and they were listed as panic disorder, separation anxiety disorder, specific phobias or fears, social phobia, obsessive compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. And that had been that way for many, many years. I mean, I don't even remember the first time I was trained on that, maybe 20 years ago. I don't think there's been a change in the anxiety chapters for a long time. This year now, with the DSM-5, there's been a huge change. So and in general, there have been more changes to the DSM-5 than any other DSM, I think. Like this year, they really have changed a lot of things. So what I did was I went through 2 chapters. That's why this presentation is a little bit longer, because we're going to talk about the chapter on anxiety very briefly. And what they've done is they've taken obsessive-compulsive disorder, because it is so important and it is becoming so prevalent, that they've given it its own chapter. And it is now called obsessive-compulsive and related disorders. So I'm guessing pretty soon we'll be calling it OCRD. And it has its own subtypes and its own features, and so it has been separated. They have now also separated and given its own chapter the post-traumatic stress disorder and similar types of trauma-related disorders. And actually, I don't think I have any slides on this at the end of the talk, but I will briefly mention a couple of disorders that are listed under the PTSD, the trauma-related section, because you'll find them very, very interesting. So right now, what we're going to do is we're just going to briefly look at what is considered anxiety in the DSM-5. And the reason I say briefly is because even after we go through the anxiety chapter, it's repeated multiple times, first in the anxiety chapter and then in the obsessive compulsive and related disorders chapter, that there is a huge overlap or comorbidity between obsessive compulsive behavior and anxiety. So let's repeat that again, because that is the critical aspect of how we are defining and seeing anxiety. I'm going to talk about that a few times. When you obsessive compulsive disorder, essentially, once we get into that, you'll see, but it consists of obsessions or thoughts and compulsions or behaviors that help reduce those obsessions. And the obsessions are usually very, very similar to anxiety. So they're like the same type of stuff that happens when you have anxiety. And that's why it was classified as one of the anxiety disorders. So right now in anxiety disorders, and I'm going to go through these because some of these might sound similar to things that your kids are experiencing. We have separation anxiety disorder. Obviously, a lot of our kids have a hard time with separation from the parent. Selective mutism. Selective mutism is when the child chooses not to speak. It is not the same as autism. I don't want people to go through and think that oh, I wonder if my child is choosing not to speak. With selective mutism, it's usually the child has been speaking for quite a while, and it's environmental. So it's specific to some environments. Like the child will just not say anything at school. And it really has a lot to do with their fear or anxiety of the environment. And then we have specific phobias. Specific phobias are obviously fears of various things. I have had many children who've gone through like different fears, you know, so they'll initially they'll be afraid of, let's say, water, and then they'll be afraid of the dark, and then they'll be afraid of various other things. And specific phobias are really very easy to get through, but they are kind of common in our kids, and you do see some of that. And then you have social anxiety disorder, which is obviously, just by the name, you can tell that this is something that's pretty familiar to our kids. So this is where the child feels very anxious in social settings, doesn't want to approach social situations. And quite honestly, Shannon, this is one where you could say that a lot of people in general have social anxiety disorder, where you don't really want to go to social settings because it makes you very nervous. Now, as I'm saying this, it occurs to me that I should make one thing clear, which is nothing is considered a disorder unless it impacts your daily life in a negative way. I mean, there's a very specific definition of this. And basically, I've used this example in the past where I've said, you know, I could go home and drink a bottle of vodka every night, and as long as I was good to my family and went to work and was a responsible adult, I would not be considered to have alcohol disorder or any kind of alcoholism. So this is very important because some of us have social anxiety. A lot of people have social anxiety, but whether or not it comes to the point where you can call it a disorder has more to do with things like you're so anxious that you will not go out at all, and you begin to sort of stay at home more and avoid a lot of situations of life. And then of course that'll turn into, let's say, agoraphobia, where you're just completely afraid of going out. Or, as you can see from social anxiety disorder, it goes to panic disorders, the next one. And a lot of people will say, I've had a panic attack. And you might have had a panic attack, I don't know, maybe 5 times in your life. But people who have panic disorder very regularly suffer from panic attacks. And it is you actually see physiological changes, heart palpitation, and a lot of symptoms that indicate they're experiencing pretty severe anxiety. And of course, agoraphobia, as I mentioned, is the fear of leaving your home or going out, and that's a very common type of phobia, and it's becoming worse and worse, and it is very much related to anxiety. And then we have generalized anxiety disorder, and generalized anxiety disorder essentially means that there are more than one situation that cause you have a generally high level of anxiety on an ongoing basis. There's a lot of people with generalized anxiety disorder. This one is the hardest to diagnose because it is you kind of come to know the person as that.
Right.
And you don't identify that they're more anxious in one environment or another because they're just generally always anxious. And what's interesting is the last four are a series that are added now, have been added to the majority, a lot of the new chapters in the DSM, and all of it shows how our thinking has changed. So the next one is substance or medication-induced anxiety disorder. And that means that you might be taking medications that are causing you anxiety. And when I start to talk about autism a little bit more, you'll see that that is one of the points that I brought up, is that we don't realize that there are a ton of medications that our kids take that actually can cause anxiety. Not even just medications. If you think about it, our kids sometimes are taking, let's say, vitamin B. Niacin, which is a form of vitamin B, gives you sort of a little rush. That's the vitamin that gives you makes you all tingle.
It's a flush sometimes.
It's a
in your
flush,
face.
exactly.
Yeah.
And that, for little kids, can provoke anxiety.
Sure.
So there's a lot of medication that can sort of induce the symptoms of anxiety. Then the next one is anxiety disorder due to other medical condition, which is awesome that they have this in here now, because as we go into talking more about autism, I'll mention several different things that actually cause anxiety or other types of problems and disorders. One example being if you don't sleep. Right. If you have a sleep disorder, you are going to be anxious during the day. It's simply that. If you have any kind of, if an adult, for instance, has any kind of other addiction, it's going to result in anxiety. So there's a lot of other medical conditions that will lead to anxiety. And then they have the two last categories, other specified anxiety disorder, in other words, an anxiety reaction to some specific thing, or unspecified anxiety disorder. And those last four have been added to all the new chapters. So when we go into obsessive compulsive behavior or disorder, you'll see the same sort of substance-induced OCD and OCD due to other medical conditions. So it's kind of like it shows the I guess the open-mindedness of the new DSM-5 in terms of everything that we suffer, of course we're whole human beings, is kind of interrelated. One thing causes the other, and so you could have other medical conditions that are causing your problems. These could be causing other issues and so on. So that's just what we're trying to say in the DSM, is that a lot of what goes on is related to each other.
To me, it seems like a very common sense approach to it. I mean,
absolutely.
As parents of kids on the autism spectrum, we know our anxiety level goes up just from our child having a diagnosis. And I think of friends who've been diagnosed with cancer,
right,
and they not only have to deal with the cancer, but they have to deal with all the anxiety that comes with all the things that are going on. It makes sense.
That's exactly right. And if you think about it, that's a great example, because I would say that, something like, for instance, other specified anxiety disorder could be something that is, induced by having a child who is ill or has a disorder or something like that. Then that would be classified as other specified anxiety disorder, unless it caused you panic attacks, in which case it would be specified as panic disorder, or so on and so forth. So what I'm trying to say is there's a lot of overlap. And one person could go from having, let's say, separation anxiety disorder to agoraphobia or to panic, and so could overlap on more than one of the ones listed here.
Okay.
Now we're going to talk about sort of what do they have in common. What is anxiety all about, really? Anxiety disorders in general are disorders that share excessive fear and anxiety. Okay, so they all have a component of fear and anxiety. Fear is defined as the emotional response to real or perceived imminent threat. Anxiety is the anticipation of future threat. Now, there isn't really much of a difference there. I mean, if you have an emotional response to real threat or imminent threat, it's very close to being fearful of the anticipation of future. Anxiety just kind of lengthens the time frame. In other words, fear is sort of what happens after, just before an event is about to happen, or just before you think an event is about to happen that's scary. And anxiety is worrying about it for a long time.
Makes sense.
It's really that clear. So, and anxiety is usually about real life events. And I'm going to put this in there because you'll see the differentiation a little bit later. So it's important to identify that it doesn't necessarily have to be actual threat that's coming your way, but it is not imagined or fantasy. What anxiety is usually about something that we think is going to happen, and it's possible that it could happen. It's real life. It's not like Martians are going to come and take me. Okay. Although, who knows if that's real? So I'm very open-minded.
Good point. Good point.
So, and the most important of all is to say again that there's great overlap between anxiety disorders and this new category or new chapter called obsessive compulsive and related disorders. In fact, there's a 76% comorbidity. That means that 2/3 of people who have anxiety have the other or the other way around. There's a huge comorbidity. So really the only reason that I can imagine that they took OCD out of the anxiety chapters is that it is such an important disorder that it needed to have its own heading and its own chapter, and we will go into that in a minute. Okay. The difference is that obsessive compulsive disorder is usually somewhat irrational. It's somewhat more fantasy type related, or stuff that, you know, most people would say, this isn't real. It can't. So the thing that you're imagining, for instance, being covered with germs, okay, is irrational. You have not been exposed to germs, and you have an irrational belief that you are covered in germs, or you have an irrational belief that some other thing is going to occur, and that's what you're obsessing about. So there's a slight difference there, that anxiety is usually real life situations, and OCD has to do with more things that are a little bit less rational. Although, having said that, I think the next time the DSM comes, they're probably going to remove that distinction, because I can think of a lot of people I know with anxiety where their fear becomes pretty irrational. But I think what they're trying to do is they're trying to make us understand that, you know, and this is how I see it. Like, when you have a very, very high level of anxiety or worry or fear about something, it will ultimately lead to other things. It'll either cause you to do compulsive behaviors, which is OCD, or it'll lead to physiological things like panic attacks, or it'll lead to avoidance completely, which is like agoraphobia. It leads to some sort of behavior or defense or physiological response because it's so overwhelming to the individual who's experiencing the fear that it perpetuates. That makes sense.
Makes great sense to me.
Okay, so the next slide, we are now going to start actually talking a little bit about obsessive compulsive and related disorders, and then I'll show you what they are, and then we'll maybe see if there are any questions we need to answer. We can keep going. So as I said, the new chapter, now we're going to really focus more on this section, because this is where it relates to autism. It's called obsessive compulsive and related disorders. So I wonder if they're going to change us now from OCD to OCRD. Very likely, because ADD became ADHD, if you remember.
Yes.
So the obsessive compulsive disorders are characterized by the presence of obsessions and compulsions. Okay. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to obsessions. Okay, so many, many examples. You know, I'm afraid that I'm dirty, I will wash my hands 100 times. I'm afraid that I left the fire on, the stove on, I'm going to go and check it 100 times. But I highlighted the word repetitive behaviors because this is where you start to see some of the similarities with autism, in that it's, in fact, when you, I love the DSM for this, but when you start looking at the obsessive compulsive chapter, there is a page and a half about the similarity to autism now. Good. And there's a lot about how the behaviors are similar yet different, and how you can try to differentiate, but that there is a huge, huge overlap. And we are beginning, people are beginning to understand that there is a very big component of OCD within autism. It's not listed there, it doesn't say it's there, because the way that the DSM functions, it's sort of like, I've said this before, when something is a little bit more pervasive and could lead to a multitude of symptoms, you go with that label. It's kind of like saying someone has pneumonia. So if you have pneumonia, obviously you're going to have a cough and difficulty breathing and possibly a fever and so on. But you're not going to get a diagnosis of, let's say, pneumonia and bronchitis, because pneumonia is kind of more overriding than bronchitis. And with autism, the expectation is that it is more pervasive and that it will influence and affect the child in a multitude of ways. So, people don't go into identifying the other types of illnesses or problems or disorders that the child or individual might be experiencing. And I actually think it's very important to do that, because first of all, funding agencies sort of depend on knowing that. It's one thing to say a child has autism. It's another thing to say the child has autism as well as anxiety or OCRD, as well as, let's say, panic attacks or disorder, or selective mutism. That's a great example. If I have selective mutism going on, it's going to require a lot more work.
Right.
And so these things are actually important to add on and not to be considered part of the autism diagnosis. I'm going to go into that more.
Because we don't want to just assume and say, well, because restrictive and repetitive behaviors are part of autism, I know that sometimes people just accept and go, well, that's autism, as if there's nothing we can do about it.
Exactly.
And that is false.
That is false. I mean, it's not that it's false. It is definitely a part of autism. It's one of the symptom criteria that leads to the diagnosis of autism. But just like anything else, it is treatable. Just like anything else. I mean, we look at these disorders like obsessive compulsive, and I'm going to talk about the treatments. Well, clearly with autism, it's the same thing. And the way to treat any disorder is to break it up, and look at its individual symptoms and try to deal with the individual symptoms. Now, there are some where we don't know very well how to control them without medication, like let's say schizophrenia. But nevertheless, schizophrenia, of course, the best treatment is still medication as well as therapy.
Okay.
So, and that's always the case. Pretty much anything I've ever studied, the best treatment is the combination of medication and some sort of treatment, therapeutic treatment. We're going to talk about how to treat some of these and the medications that help as well.
Would you like to take a break?
I think I'm going to just see. Sure. If there's,
okay.
Let's take
Let's take a short break, because I don't want to work you into the ground.
Okay.
This is a lot of information, so we're going to take a short pause, and we'll be back more with Dr. Doreen Grandpichet. This is the Anxiety Show. Stick with us. Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Grandpichet, and this is the much requested show, the Anxiety Show. We should say it's the first, because we're planning on this taking more than one show, because we want to take our time. This is a very important topic, as you were saying, because it so affects our community.
Right.
And I think primarily we're really interested in knowing about how this affects our kids, but the secondary is that it affects the parents as well.
Oh, absolutely, yes. Our parents have a lot of anxiety generally.
I can speak to that.
Yeah. No, it's not hard to develop anxiety symptoms when you have a child you're worrying about all the time.
And knowledge is power, and understanding how these symptoms come about and what to do about them is a powerful, powerful thing. So Dr. Grandpichet is here today talking about this with us, empowering us. We thank you for that. We went through some of the differences between the DSM-4 and the DSM-5 and how these things are categorized. So where would you like to pick it up now?
Well, we're going to talk, now we're going to just continue and talk a little bit about the obsessive compulsive and related disorders. And then I will just start going into how they relate to autism as a whole.
Great.
So
we need to tap the screen here.
Oh, okay.
Okay, there we go.
Okay. So the obsessive compulsive and related disorders are listed below, and I highlighted in red the ones that I find to be very commonly seen in ASD. For instance, and we'll go through them, obsessive-compulsive disorder, which I will go further into. Essentially, as I said, obsessive-compulsive disorder is, having obsessive thoughts about something and then doing compulsive behaviors to try to reduce those thoughts. Body dysmorphic disorder is one where you actually have different, you obsess about various aspects of your body. Okay, very
So-
simple.
Could result in anorexia, or
Oh, it could absolutely could result and develop into anorexia or other types of, people who, for instance, have a lot of plastic surgery or
Okay.
various other things.
Okay.
Hoarding disorder is where you carry around or you hoard objects. So in other words, I mean, we've all now seen these shows about hoarders and people who will not throw things away and they will keep them. And what the general public doesn't realize is that this is actually a form of anxiety, because it shows that the individual is so afraid that they are trying to sort of, surround themselves with things they own that will help them feel safer. It's always an obsessive thought, a fear related thought, and then a behavior which helps reduce the fear. And in hoarders, it's keeping things around them. Now, I've highlighted that because I know a lot of my children will carry objects, so they will, for instance, you'll see that they'll have a couple of objects that they carry together, and a lot of my kids will have like a little drawer or a little place where they put all their stuff, and they don't let anyone touch it because it's my stuff. And it's, or very basic form of this is carrying around your blanket all the time, and it's not really hoarding, but it's the same concept as this object is necessary for me to not feel anxious.
And going back to what you were saying about the panic, all the things under the anxiety, someone might be listening to this and think, okay, well, my garage is a mess, but that's different than, it has to get to the place where it's disabling to your life.
It's extremely disabling. Okay. Yes, it's not really. I mean, we have opinions about who throws enough away or doesn't throw. There are some people who throw everything away, other people who don't throw anything away, but hoarders, again, it becomes debilitating.
It's another level.
Right,
okay.
Absolutely.
With all of these things, it has to be at a certain level that it's preventing you from leading the life that you could lead.
Exactly.
In order for it to be classified as a disorder.
That's correct. And then we have trichotillomania, and trichotillomania is pulling out hair. And, I knew someone actually who had trichotillomania, and they were constantly, it was a man, and they were constantly pulling out hair from their beard. And it's an anxiety type of habit, and it's just, you're just pulling out hair. I don't know if you've ever seen that.
Yes, it's a very interesting disorder.
It is. And it's as you notice, the commonality with all of these is, the obsessive or the anxiety feeling and then the repetitive behavior. Remember, that's how we defined it. It's always an anxiety feeling and then the repetitive behavior. So it's kind of interesting. Excoriation disorder is picking skin when you're anxious. And as you know, a lot of our kids do this, so I actually highlighted that as well. And so it's important to note that when you see these things, start thinking about, well, what does it mean if your child is actually from anxiety, for instance, picking skin? Now, this is different from, let's say, a child who might have a injury. Right. If you have an injury, it's very common for us to try to pick the skin. That everybody does that. I did that when I burned my hand. But that's not the same thing. And here we're talking about people that if you have excoriation disorder, or if you've seen someone with this, you know what I'm talking about, because it gets to be very, very difficult to control.
Yes.
And this is really just because it's a repetitive behavior. And it's, as I said before, somewhat irrational. But it is something that you do, and unless you do it, you're going to feel anxious.
Yeah.
Okay. Then we have, of course, substance and medication-induced OCRD, or obsessive-compulsive related disorder. And I'm going to go more into when I talk about autism, but there are a number of medications that can be increasing the anxiety that our kids experience.
Would PANDAS come in to play, or is that an entirely different thing?
Very different thing.
Okay.
PANDAS is sort of the pediatric autoimmune neurological disorder associated with strep, PANDAS. And that is a series of kind of problems and issues and delays that come about if you have had strep infection at some point, and it has led to an autoimmune reaction, which has led to neurological problems.
Okay.
And that is, one of the subsets of autism, and it's easy to diagnose actually because well, I mean, first of all, it's surprising. You'd be shocked how many people don't even know if their child had exposure to strep. You don't necessarily have to have seen the symptoms of strep. So a strep titer is done to identify that. But the second thing is that usually with kids who have pandas, it was a sudden decline. So it was kind of like the child was progressing, and then at some point there was a sudden drop. And it doesn't have to be the early years. It could be later as well.
Okay.
So that's a little bit different. But you know, substance and medication-induced stuff is like you're taking, let's say, medication for ADHD, and that will automatically cause some level of anxiety because it's an amphetamine.
Okay.
So, you eat mass quantities of chocolate or red dye, substance-induced.
Okay.
So a lot of the stuff that we eat in our food could be increasing our anxiety levels as well.
Interesting. All right.
Yeah, that's where
Very
the dietary
interesting.
stuff comes in.
Yeah.
Other specified and then unspecified. Now, as I said, that's pretty much in every chapter now. But what I liked about the unspecified obsessive compulsive and related disorders was that they listed a few, and one of them was body-focused repetitive behavior disorder.
Wow.
Body-focused repetitive behavior disorder. So we're talking about...
Here we both automatically start to rock.
Right, so we're talking about certain repetitive behaviors that are just within our body. Now, this is fascinating to me because, and I'm so glad I came into the field of psychology because I should have been nowhere else. Like I'm telling you, when I pull up the DSM, you know, and I start making presentations about other stuff, and I am in there for 6 hours. Like I just don't even want to leave. This is very interesting because I remember I have known people who are not at all on the spectrum of autism, and in fact extremely intelligent people, and not at all in any way hearing impaired or anything else that could lead to this kind of body rocking, but they do when they're anxious literally body rock.
Yeah.
So there are people who do literally do that just from anxiety. You know, in our kids you might see that, you might see a lot of the, and it's funny because with our kids anxiety and excitement are very difficult to differentiate, obviously, and so when you see our kids very excited, they'll do this as well.
Right.
You know, and if with little children in general, not just kids on the ASD spectrum, but just little kids in general, they'll jump up and down if they're excited as well as if they're anxious, like when you're fearful and so on. So the commonalities between the obsessive compulsive disorders are that here's some different aspects of them. So there's the commonality, as I said, is always there's some obsession and then there's a compulsion. So these are the different types. A cleaning OCD, which means there's contamination obsession and then cleaning compulsion. A symmetry type of OCD. So that means there's an obsession about things not being in perfect order, symmetry, and then there's a repeating or ordering compulsion, and that's the one that you see the most in ASD, where I think we even had some questions on this, where you see a child will put things in a particular order, lining up objects, their toys and so on, or items, and getting very, very upset if you change the order of the objects or if you destroy the line. So this is actually a very common thing, and it's not just in putting things, not just in tangible order, but it can be stuff like there's no symmetry because you're taking me to school from a whole different direction that we usually go. There's no order. Doesn't make sense because we've never done this before. So change.
And inflexibility.
Inflexibility. That's exactly the word. It has to be this way. It's the things have to follow a particular sequence, and if they don't, it's the end of the world.
We actually have a question having to do with this. Do we want to wait for that towards the
Sure,
end? Or just
we can throw it in right here.
Hi, Shannon and Dr. Doreen. Thank you so much for discussing a very important topic. My daughter is 8 and was diagnosed with autism when she was 3. She likes to keep things in their places, like toys and bags. She also likes to close open doors and zip up bags. She gets upset if we change the places of of the toys or backpacks and insists on putting them back. If the bathroom door was open, she runs to close it and gets frustrated and bites her hands if we try to block her. What is the best way to manage these behaviors? And we appreciate Dr. Doreen's feedback in advance.
So we're going to talk a little bit about how to treat these behaviors later, probably more next week. So please stay tuned with us, because if I jump into that, I'm going to kind of go heavily into the.
Absolutely.
But the thing is that, you know, I want people to think about it this way. Like, if someone is blind, okay, if someone does not have the ability to see, they will. How do they manage in their home? They place things in a particular place, and they don't want things moved. And the reason for that is so that they know where things are, right? Because they can't see them. So they know where things are, so they can depend on things being where they left them. And that's how they function in the world.
Right.
Okay.
It's a great coping mechanism.
It's the only way that they can cope. Exactly. So now think about it from an autistic person's perspective. Things are placed in a particular way because they receive. Now it's more irrational, obviously, because you can see as well to some extent, and who knows how well our kids actually have visual skills, but some of our kids. But it gives you a sense of control. Having things in a certain order removes completely the surprise element. There is no surprise involved. So with your child here, there's no surprise, and she wants, and you know, everything that this parent listed has gone to an irrational level or to an excessive level. But if you reduce it, then you can see how it developed. It's like, okay, so what were they? She places things in an order, I think.
She likes to keep things in their places, like toys and bags.
Right.
She also likes
so that she knows where they are.
Right. She likes to close open doors.
Right, because that gives her a sense of safety. Now, keep in mind, we're always talking about behaviors that reduce fear, reduce anxiety.
And zip up bags.
Yeah, so that they remain orderly or clean or whatever.
She gets upset if we change the places of the toys or backpacks and insists on putting them back.
And then she gets all worked up and bites her hand and so on. And as I've said multiple times, biting and those types of behaviors is simply communication. She's trying to say, don't do this. It upsets me when you change the order of things. And I don't want anything changed because this is the only way I feel safe in the world. Very simple. So you understand the cause, you understand what's making her feel that way, but you don't want to really reward the fact that she's biting her hand every time. So that still means you behaviorally intervene, and you don't necessarily stop doing what you're doing every time she bites her hand, because then you would be rewarding the hand biting. But it's always important to understand the reason. Remember, we talk about the function. One of the things we're writing a book right now, and I kind of want to be brave and write a new thing about how we talk about the function of things being, the function of behaviors are always like to avoid something or to gain access to something. And one of those key things in my mind is to avoid or reduce anxiety.
Absolutely.
A lot of what we do in our world is just to avoid anxiety. A lot of what we do, honestly. If you think about it, something as simple as alcohol. Drinking alcohol has to do just simply with reduction of anxiety. That's all it is. What do they say? It reduces inhibitions, which means it reduces fear. So, and because I'm one of those people that believes life is about fear, like overcoming your fears, that's why we do all the different things we do. Now, with this child, it would be important the reason it's important to know why the behaviors are occurring due to anxiety is because then you can help the child overcome the anxiety. And that's where you focus your attention, is doing things that will help the child overcome the anxiety. And there are many things you can do, medications being one, and we'll go into some other cognitive behavioral treatments as well.
Okay.
So now with the OCRDs, the other two, forbidden or taboo thoughts and harming self, or obsession about harming others, is stuff that we don't very commonly see in our kids. So I'm just going to try to skip over those and keep going. Okay.
Okay. Do you want to take a break?
No,
Okay.
I'm going to keep going because we don't have very much time left.
That's
and then
true.
Next week we'll go heavily into the relationships. Let's just see where we are now.
Okay.
So one of the really important things, I know a lot of people will ask this question, is that, when you look at first degree relatives of an individual who has obsessive compulsive behavior or disorder, so that means, first degree relatives, so child-parent type relationship, is the rate of obsessive compulsive related disorders is double in first degree relatives. So in other words, if you have obsessive compulsive related disorders and I don't, okay, that's the normal relationship, but your child might have twice as much the likelihood of having obsessive compulsive related disorders. Now here's the second point, which is more important. If you had obsessive compulsive disorder as a child, then the likelihood that your children will have it is 10 times as much.
Wow.
Yeah. So that I found to be very interesting because, it is something to think about.
It absolutely is something to think about.
And and we don't know right now, we call it, it's under the heading of genetic components, but you don't really know if that's true, because I was thinking about this, and if you as a child have obsessive compulsive disorder yourself, the question really is if you've gained control over that as you become an adult, because if you haven't, then it's possible that you would your anxiety would then kind of affect your child's or your family members. So that's it's sort of a behavioral or environmental component of it as well.
I absolutely, I've shared before on the show that I have some of these things that we're talking about.
Yes.
I certainly have battled anxiety and OCD, and like a lot of moms who have children on the autism spectrum, I fully, go, yep, I have some of these things. And it wasn't until my son had autism that it got to a rate where I needed to seek out help. I didn't seek out help until I saw my son starting to engage in some of the behaviors that I did. And that was when I got my wake-up call, and I said, okay, this is not okay.
Yep.
I have to get help for this, because otherwise I will have changed the way he looks at the world. And I just refused to do that. It was hard, but I got help.
Yeah, that's exactly right. It's so sad when you see, I go back and I think of some of my patients and also some people that I've known, patients outside of ASD, and it is really, really sad. I mean, it's pretty debilitating. I remember, first of all, I remember someone I knew who had their OCD had become extremely severe, and it had turned into agoraphobia. They would not leave the house, and when you went to visit, she had gloves on, plastic gloves on, and a sort of a cleaning spray and thing, and that's how she lived from the minute she woke up. And it was extremely sad, not just to see what she was going through, but how it was affecting her. I think her daughter was maybe 14 or so at the time, and it was really causing, like, even to a level of psychosis for her daughter, because her daughter was having, must have probably been through many years of this. And it causes an ongoing fear, because you never really know when the person is going to react to you and blame you. I mean, I knew someone else who actually used to get very angry if someone had hair, a strand of hair that would come off, because it would freak them out that it's going to fall on the floor or something. OCD can be pretty severe. And then I remember a mom I had who wouldn't even come to our clinic many years ago because she felt that the world was too toxic, and so we couldn't actually help to see her child because she wouldn't leave the house with her child. She wouldn't allow the child to go to school. Not because she was worried about the child, she was worried about the child bringing germs home to her. I mean, it can be very devastating.
Yeah. I mean, I stopped driving. I was 40 whatever years old, and I stopped driving and pretty much had said that I was never going to drive again.
That's amazing.
And I was somebody who had always been a road warrior. I'm a road warrior again. I commute a great distance to come here every morning, but I had stopped driving for over a year. And so when we came to clinics, my husband had to be present. I mean, usually that was the case anyway, but he absolutely had to be, because otherwise we couldn't drive here.
That's amazing.
So, I relate to a lot of these things, but quite honestly, I mean, it got exponentially worse the more we got into autism. And I saw that, you know, because I was going out less and less to the point where, you know, I pretty much the only thing I was going out for was to come here to clinic. And it was a day that my son, we had to go someplace, and here he is supposed to be having a social program, and he stood there and said, I want to go home. I want to go home. I don't feel right. I don't feel right. I want to go home, which is something that, you know,
understood.
I had said. I'm just keeping it real here. I had said that to my husband. I just want to go home. I don't feel good. I want to go home. I want to go home. And here my child had picked that up. So it is essential that we all, you know, it's hard. It was hard to face it. It was hard for my husband and I to face it, but because I didn't want anybody to help me with it, because I didn't want to drive again.
That's right.
you know, but you know, you have to get help for yourself and you have to get help for your child.
Absolutely right. Right. That's right. And you made me think that instead of going into sort of this, I want to skip to another area where we look at anxiety in ourselves. If I'm going to leave people with anything this week, I want you to start thinking about, let me just see if I can find those slides. I want people to start thinking about anxiety in yourself, because when you understand anxiety in yourself, as you say, Shannon, you can really help to treat things and to help your child, help yourself. It's very, very important that you are able to come from that. You know, how do we define anxiety? We define anxiety as a normal reaction to stress. It starts that way, right? It helps us deal with tense situations in the office, study harder for an exam, keep focused on an important speech, whatever it might be. In general, anxiety helps coping, okay? But when it becomes excessive, there's an irrational dread of everyday situations, it becomes a disabling disorder. That's how the National Institutes kind of views anxiety. And the truth is that when you study anxiety, I remember this many years ago, there's a curve that occurs. A certain level of anxiety is extremely helpful. And if you don't have that, then you become lazy, you procrastinate, you don't care, you won't go and do anything, you just don't care about stuff. So a certain level of anxiety, people who have a small level of anxiety prior to an exam will always do better. But an excessive level of anxiety just makes your behavior fail.
So there's a window we want to be in.
You definitely want to have, you definitely want to have a slight amount of the ability to have some level of anxiety, and that's kind of important. Now, see, my slides are kind of out of order here, so it's hard to find the slide that I want to look at, but I want to go to the concept of helping you to find anxiety in yourself, and I've listed some of these things. Let me find that slide. Okay, here we go. What are some of the things that you call anxiety? And this is really important. Like, we are, when you're anxious, some people, these are different things. I asked different friends and they put this up for me. So I work when they have anxiety. Some people will eat too much when they have anxiety. So always remember, notice that it's always a behavior change, you know? Some people will just obsess and worry. Others will have racing thoughts. Someone said this to me, so it's kind of like you jump from one thought to the other, which is kind of interesting if you think about our kids not being able to focus.
Absolutely.
You can have heart palpitations. You can have things such as irritable bowel syndrome. So it does actually affect your GI system. You can feel dizzy. All right, these are some examples. And I just want to go through this slide as well. I know we're running over time, so I just finished this slide as well. And how do we deal with anxiety? Now, this is what's important, because you'll notice that people deal with anxiety in a million different ways. And when we come back next week, we want to talk about adaptive ways to help our children deal with anxiety instead of, you know, they could choose non-adaptive ways.
Right.
So some people will, I'll distract myself. That's what someone said to me. I will keep myself busy. Okay, I will talk to my friends or gain reassurance. Well, our kids don't do that. They can't. I pray. Our kids don't have a concept of that. But that praying, if you think about it, is sort of a repetitive behavior that comes out of reduction of fear. That's when people pray most, right?
Absolutely.
I take medications to help me. I exercise. That would be a very adaptive, healthy way to deal with it. I breathe, I meditate, I do yoga. So this is one of the areas that I'll talk about next week, what we can teach our kids. I practice positive self-talk. I try to change my beliefs. That's what I think more than anything else ABA helps our kids to accomplish, is that they actually start to learn that their thoughts are not rational. I try to change my beliefs. I avoid what's making me anxious. That can lead to complete avoidance, which is not good. I take drugs, alcohol, or I try to change what's causing me anxiety. So these are, you know, and whenever you see the word change in behavioral terminology, that means shaping. So next week, what we're going to be talking about is behavior change and how do we make that change occur. What I'll do next week is I'll go more into sort of what happens in autism that leads to anxiety.
Jack Riley. Jack Riley, say hi, Mommy.
Hi, Mommy.
Turn and look at me when you say hi, Mommy.
Hi, Mommy.
Good try.
Hi, everybody. Hi, everybody. Hi, everybody.
So how are things?
They're good.
Yeah.
He's doing great. He had an incident.
What are you gonna
4th of July, we were out swimming with
you wanna
another
play with?
family out there, and he pushed a little girl in the pool. Little 3-year-old.
Was he playing or?
Well, yeah, she was jumping in, and there was the steps, and her dad was watching. She'd jump in and sort of paddle to the steps, and she kept doing it. And he was laughing, and she was laughing, and then he just helped her.
Mickey.
So it wasn't malicious, but
Yeah, he wasn't angry. I think it was.
and they did it again though. After we so we took him in.
It was more than like 5 minutes. I didn't make note of it.
Cracker.
You want a cracker? We'll come and get it.
There are two skills being displayed by Jack Riley right now. One is that he made eye contact, and the other is independently requesting an item without any prompting. These are both skills that he and his parents and therapists have been working on.
Can you say, I want cracker?
I want cracker.
Can you say, I want cracker?
Cheryl is prompting Jack Riley to use more than one word for his requests to build on his vocal skills. When Jack Riley began services 3 months ago, he was non-vocal with very little verbal skills. To be verbal is to communicate, whether it's with a gesture or signing or using pictures, for example. To be vocal is to communicate with audible words.
So if you had to pick maybe like your top 3 things to work on like when you're out in the community.
Trying to figure out what will make him compliant, you know, in public when there's a lot of people. He kind of took off twice for the street.
It's inconsistent enough that you can't count on it. There's days that are great and days where he does one of the.
Or he'll say go.
And then, yeah, go. He says stop and he says go and starts up again.
Him staying with us, him even just walking hand in hand without,
Okay.
I'd say within fewer than 10 steps, he goes noodle and sits down.
So what I'm gonna do is I'm gonna add an outing section in here. And then if you want whenever it works for you guys, at least if we can do it at least once a week. One of these guys go on an outing to wherever you guys normally go.
Just to start getting him used to that, because it seems, yeah, with the activity, everything changes a little bit from him. Just gets so excited, and that's when I think most reason stops for him, and most of what he learns sort of goes out the window.
Yeah.
Okay. We're gonna spiral down. Spiral, spiral, spiral. Yay! Oh.
To me, he sounds like he's talking more than before. I don't know. That's what I observed. Huh. You're talking a whole lot today. Do you want to play with your trains? Yes. Good. Okay, should we open?
Open.
Okay. Say open, please.
Open.
The fact that he is actually communicating is really, really cool. And they're actually words instead of just, utterances or, gestures. Yeah, it's really incredible. Incredible. Say, let's go.
Let's go.
Okay. Choo-choo, come on. Wow, you did.
Right there, Jack Riley independently began playing with his train appropriately. What you see is what a typically developing kid would do, naturally. But kids with autism, most skills need to be taught until the behavior becomes natural. At this age, half of the ABA therapy occurs while the child is playing. The other half is in a structured environment and at the table, like you've seen in other episodes.
You know the train station?
Twice.
Station.
Yes.
That's a hard word. Station.
Yes.
Do you want it?
Yes.
Okay, here you go. Wow, his yeses are very good. They are. Oh, and for NVI, we're also doing two-step actions within play. It's like basically whatever it is he's playing with, we just have to do two-step actions, and he has to be able to imitate whatever we do. Do this. Choo-choo. You do it. Say choo-choo.
Choo-choo.
Good job. Okay, let's put it on the track here. Do this. Choo-choo. Check Riley's turn. Say choo-choo. Choo-choo. Yeah, here we go. So it's like little actions like that. Just, putting the train on the track, making it go, putting items in the train, imitating even vocally, like what we say during play. Like, here we go, choo-choo. Just so this will help generalize when he goes to preschool, because other kids will, be playing with trains too, and children naturally just imitate each other.
Right now, Jessica and Jack Riley are practicing using yes and no appropriately.
Do you want the shoe?
Yes.
Okay, here you go.
Yes.
Say no.
No.
Good. Stop. Put your fingers. Do you want the shoe?
Yes.
Say no.
No.
Good. So do you want the shoe?
No.
Okay. Do you want the ball toy?
Yes.
Okay, here you go.
Bottle.
Here you go. All right, it's over. Okay, here. Do you want a diaper?
Yes. No.
No. Okay. Do you want a diaper?
No.
Okay. Do you want a ball toy?
No.
No. Do you want the cars?
No.
No. Do you want a Nemo car?
No.
Okay. Do you want bubbles?
No.
No.
Yes.
Yes? Okay.
Boo puppy.
Pop, 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 pop.
Boo puppy. Boo puppy.
Hi. Can you sit up though? Sit up. Stand up. Ready? Sit.
We have new snacks for him because we started to incorporate gluten yesterday. So I've got some stuff
Okay,
that he hasn't had in a long time. Like we tried putting cut up bananas on his pancake plate last week, and not so well. He just threw them down. So I thought that kind of stuff would be easier now because he'd been doing so well, and he's not. So we're still gonna have to have the battles, and I think we're just so happy to be done with the first battle, that we're sort of reluctant to start a new one, which is to start introducing new foods.
Yeah.
But the cool thing is now that we're taking him off of the GFCF stuff, we have more things to introduce him to.
Definitely.
And maybe he'll just get less anxious if we're giving him things that he used to love this stuff, but we took him off of it. He won't remember, but maybe it won't be such a big deal if some of the new foods he's getting are things that he's loving. Do you want to try cereal bar?
Ooh, yummy.
Are you looking funny?
Oh, Jack Riley.
Look better. Do you want to try cereal bar?
Cereal bar.
Cereal bar, good talking.
Cereal bar.
Do you want to try?
Cereal bar.
Cereal bar.
Crystal clear.
Cookie.
You want to try?
Cereal bar.
Try these. I love these.
So yummy.
I like it.
You want cereal bar?
I cereal bar.
Mommy,
Bobby.
I want.
I want cereal bar.
Good job.
That was a good
That was
sentence.
very clear.
Yeah.
Slow.
Cereal
He
bar.
sees it. So the more subtle we can
Cereal
go,
bar.
the.
Cereal bar.
Do you want more?
Bar.
Can you say I want more cereal bar?
Cereal bar.
I
I
want
want
more.
bar. Cereal bar.
Good job.
Cereal bar.
Yeah.
Cereal bar.
It is a cereal. That's your new favorite
You
word.
have a new favorite, don't you?
Cereal bar. Who's here?
you eat something?
What did you eat, Jack? Tell Daddy. Goldfish. Goldfish.
Goldfish?
And what else did you have?
Anything else?
What else did you have?
What else did you eat, Jack?
Super.
What is it?
Good, that's answering a question like she asked us if you could do that.
What is it?
Super.
A Nutri-Grain bar. So he
You
just
ate a
had,
Nutri-Grain bar?
and the fact that he turned to Daddy to say that too, that was big.
Just right there. Did you catch it on camera, Suzanne?
Yeah, I did.
That was really, and it was so
And he
good.
just answered questions about the past to you.
What?
He just answered questions about the past. Like he never.
That's true.
The doctor last week asked if he could do that.
Okay, I'm not going anywhere. I'm just right here. Right here.
The reason Cheryl is excited about Jack Riley answering Mike's question is that he was able to understand what he said and could recall what he had done in the past without any cues in front of him to remind him. Recalling something in your mind is a complex skill. This is a big leap. It means he grasped language.
Good morning and welcome to Let's Talk Autism with Shannon and Nancy. I'm Shannon.
I'm Nancy.
Hi, Nancy.
Hi, Shannon.
We were sitting here for the longest time, and then
Just
time sped
yakking,
up like it
yakking,
does.
a couple girls yakking.
So I promised that I would tell them, because we didn't do a show yesterday, and I said there's a really good story for that, because I felt that there was a possibility that I might have pink eye.
Okay.
But I don't have pink eye, I have carrot eye.
Carrot eye, and explain that to everyone.
I was having some itchiness around the eyes, and I felt that my eyes were a different kind of color. And I don't have pink eye, though. I've been drinking a lot of carrot juice and eating a lot of carrot juice.
I can attest to that. I see you drinking carrot juice
Yes,
constantly.
that's what I live on and have for several months, and squash too. And
squash.
so the doctor came and she looked at my eyes and she said, I don't think we're talking about pink eye here, but I have to ask you a question, my dear. Why are you orange? And I had no makeup on, right? And I said, oh, you know, I'm always kind of ruddy complected. And she said, no, you're orange. And I said, no, I don't have makeup on. And she said, I'm looking at your hands. So my hands, I think you can see on camera, are distinctly orange.
And last week, I noticed your hands had an
orange
orange tinge. And what I thought was that you had put some of that self-tanner on.
Which is hilarious to me.
And
'cause I'm the
hadn't
last person
washed
that
your
would.
hands
Right,
properly.
appropriately,
And
yeah.
I was going to say something, but I thought it was rather rude because I thought, well, that'll fade. But I
No,
thought that's
turns out
interesting
not.
that Shannon was putting self-tanner on. Why would she be doing that?
Shannon is not a self-tanner kind of
You're
person.
not.
And so when I called Nancy and I said, yeah, I don't have pink eye, I have carrot eye, and told her, she goes, yeah, you know, I noticed that.
I noticed your hands looked a little orange
Yes.
last week.
And
So
people have
what-
been saying, you look really tanned. And
Have they?
They have been.
Well, from what I understand, people actually used to do this before self-tanning became all the rage, like spray tans and all that. They used to drink carrot juice to get tan.
Well, I can tell you it works, but your palms will be orange as well.
Okay.
And it's not necessarily good for you. Apparently, you can get to beta-carotene toxicity.
Okay.
I don't know at what point.
So are they weaning you off carrot juice, or do you
Well-
have to go cold turkey?
Well, no. They said that I needed to limit it, and I haven't even started that yet because it's, you know, what else are they going to take away from me? You
I
know?
know. Isn't it the truth?
Please, I don't do dairy products anymore. I can't have wheat. For 30 years, I haven't smoked a cigarette. I don't eat sugar.
You don't
I
drink?
don't drink.
I know. I can't ever drink with you. That's kind of sad for me.
Yeah, well, so it's like, what else is left for me? There's nothing
I know.
left.
Well, I've been getting migraines, and so, I've had to cut out the red wine and the chocolate and those things. And I just, what is left for us? It's very
Yes.
kind of sad.
We're just going to have to make our own fun.
I guess.
I guess
if
that-
anybody
that's what
has
it is.
any advice and tips on things you can do for fun that don't involve anything
What are
that's
the
bad
guilty
for you.
pleasures anymore? Yeah, we don't get any.
Well, they say sex is still okay, but
All
who
right.
has time for that?
Yeah, who has time for that?
Okay.
Especially when you have kids on the spectrum. That goes back to respite, which we're always talking about. Who is watching our kids? But I'll put my husband on notice that that's the only thing left for me. Honey, you've heard it here from Nancy.
Okay.
All right. A lot of news to cover today that is very interesting. I wanted to start with, and by the way, we should tease who our guest is.
Yeah, we have
little
a
bit later
great,
on.
very enthusiastic gentleman.
Ryan Judd.
Yes, he has a company called The Rhythm Tree, and he's a music therapist, but he's a very I think he's so enthusiastic. I loved his website. I loved some of the videos I saw with him.
Yeah.
And he works with kids on the spectrum, and he's going to be talking to us about the 10 great ways you can use music to help individuals with autism, which is going to be fascinating.
Very exciting. So, but we wanted to get to In the News first. First story, brain scans of premature babies reveal changes that may raise risks of autism. I found this article very interesting because we've known for quite a while that there are some differences in a premature brain, but looking at some of the things that grow in the brain in the last couple of weeks of a pregnancy, and the differences, sensory differences between being in a very contained space in a womb for those things to happen, or being in a preemie, you know, in the little incubator things, and being in that kind of a unit that could have long-term effects on how you process things sensorily. So very interesting. It makes me wonder whether now they're going to change the sensory outlook of how preemie units look like. I've had the opportunity, because a family member had a baby that was in a NICU, the neonatal intensive care unit, and it tends to be a little bit quieter and a little bit less light, but I wonder if they're going to take that to a more extreme now because of these findings. It's pretty fascinating.
Yeah, it's researchers at King's College in London, and they did find that they are more at risk of autism and other behavioral conditions.
Absolutely. I feel like all of the stories that we have today are almost all but one are very British based.
Yeah.
Because the other story that has been all over the news, and we kind of have not touched on it yet, but it just keeps on going, is this story of Katie Hopkins.
Yeah, who apparently is a talk show host. This morning, I guess it's something like the Today Show or Good Morning America.
And I believe that she has an article in a newspaper in England, and apparently makes comments on a regular basis.
She's very
that are
controversial.
a little bit incendiary. But there was a series of comments made about Ed Miliband, who is a politician over there, the Work Party, and they've gotten worse and worse. Some of the different comments that she said when he was on camera speaking, one of the comments that she posted on Twitter, she said, "Ed, stop looking at us, you're weird. Look at people, not a machine. Try to act off the spectrum."
Right.
So that was sort of the opening salvo. And then another time she tweeted, "Have just seen that lovely Ed Miliband on my TV. For one, so clearly on the spectrum, he really is a high achiever. Well done, Ed, go you." So, you know, and I guess that in the past she has talked about many different types of mental illness, dementia, weight issues.
She's, really gone after those.
Yes. So this time other people have spoken out, other celebrities have spoken out, most notably Stephen Hawking's daughter, who I did not know until this, that her Stephen Hawking has a grandchild who is on the autism spectrum.
Yes, and Lucy Hawking, his daughter, apparently wrote a polite piece in The Guardian last Thursday. "Dear Katie Hopkins, stop making life harder for disabled people." And Hawking said that when someone with your public profile tells others that it's okay to mock people with disabilities, you cause enormous damage. Well, someone tweeted then, finally someone, you've chosen, is it me or have you chosen against defending yourself from comments by Stephen Hawking's daughter? Finally, someone has shut you up. She said, "No, darling, she just falls into my list of people given a voice because of their parents." As you say, Stephen's daughter. Well, you know, Katie, I doubt that the only reason that Stephen Hawking's daughter has a voice is because she's Stephen Hawking's daughter. That's rather rude.
And in fact, that celebrity tweeted back to her and said, "No, Katie Hopkins, she is the daughter of a severely disabled man and the mother of an autistic child, you ignorant B word."
Yes, and we might say a severely disabled man physically who is, without a doubt, one of the most brilliant minds to ever grace the planet Earth. So, which shows you that despite disability, we can certainly have people of brilliance. And if this woman doesn't know that, somebody needs to educate her.
Yeah, please.
Okay.
The other news story that I missed by a couple of days because it happened so quietly.
Yeah.
That Autism Speaks co-founder Bob Wright has stepped down as the chairman.
As chairman, and I guess that means that Suzanne is no longer, well, she'll probably be stepping down as well. I don't know what, she's a founder, but they'll still be the founders, obviously.
Yes.
And yeah, I think Bob Wright, you know, he's an older gentleman. He's run a lot of companies, NBC, Universal, and he has been, you know, obviously a very important figure with starting Autism Speaks, which has brought so much attention to autism, clearly.
Yeah.
And I think he's been very influential. You can't understate his influence in the autism world. No. And he probably, it's time for him to move on to other things like enjoying the good life. And
it is the 10-year anniversary. I mean, it makes a certain amount of sense. But it happened very quietly. A press release went out on May 1st declaring that he would step down on May 1st. Right. The person who is taking his place is a gentleman named Brian Kelly, who is no stranger to Autism Speaks. He is an autism dad.
Right, and he was on one of the committees, I understand.
And is a person here from Southern California. So we'll certainly look forward to hearing more from him about what he wants to do. It should be noted that the Wrights have several different places that they're going to be honored later on this year for their decade of service.
In LA, one of them, and in New York.
Yes, on October 8th here in Los Angeles, and the Winter Ball at the Metropolitan Museum in New York on December 8th. So I think what an amazing couple, Bob and Suzanne Wright, as grandparents. I always find it interesting when people begin criticizing something, and I always want to, because my thought is, have I done anywhere near what these people have done?
Right.
And, you know, as grandparents, I cannot think of another pair of grandparents who have done more than Bob and Suzanne Wright have done. Whether you agree with everything that Autism Speaks has done or not, these are two grandparents who certainly had their hearts in the right place and have worked really hard and taken a lot of guff for it. I try to think about if my mother had started an organization that got as much guff, how my mother would have taken it, and you know, I can't imagine.
Yeah, I think they've risen above the fray. I think they have every right to be proud of their accomplishments and the attention, if nothing else, the attention that they brought towards the autism epidemic and what is happening to a whole generation.
Undeniable,
of children.
The work that they have done.
So
we wish them well.
Yeah, we wish them very well. And also Mr. Kelly, who is going to be taking over.
Congratulations to him.
Yeah, and his wife. And it looks like they've done a lot of great work and donated a lot of money towards autism research. And I'm sure he'll continue to do a lot of great work in the field.
We'll look forward to hearing from him. We'll send him an invite to be on the show.
Yes.
We've invited Bob and Suzanne to be on the show before, and it's never worked out, but maybe in their retirement, maybe they'll have some time to join us. That would be very fun. All right, we should take a break. We have a wonderful guest. We want to leave lots of time for him. Ryan Judd, as we mentioned before, from the Rhythm Tree, will be with us after these messages. Stick with us.
You say howdy, we say hi. Let's get wild, let's get wild. Let's get wild. Let's get wild. Let's get wild. Let's get wild.
Welcome back to Autism Live. I'm Lisa Ackerman with Taka. My guest here.
I am Jennifer Lucero with Taka.
Taka Mom is here in the house. Jeff saw on a TV commercial, they were making calzones, and he looked at me and goes, Mom, please make me that. Wait a minute, yeah, calzone, you can't have calzone. He goes, well, you make me pizza. Why don't we call it a puzzone? So we're going to do this ode to Jeff, puzzone. So I'm going to have Jen come on in.
All right.
You're on charge. We're going to add a little grapeseed oil, garlic, cut up chicken, finely cut up onion, and we're going to throw a little bit of basil. So we're going to just take about 5 minutes or so saute up the chicken and all of the onions together. While Jen is slaving away at the stove, I'm going to make the pizza crust. A lot of gluten-free choices that you have out there for pizza crust. So I'm going to go ahead and start with the dry. Again, I'm using eggs. There are a lot of egg replacers on the Taco website. We have about a dozen different ways to replace eggs. So I'm going to go ahead and add my shortening. Calls for a little extra salt, which I'm going to put in here. And also add a little pepper. And we also have herbs de Provence that gives the crust a nice Italian flavor. Can't forget the apple cider vinegar, organic stuff, ready to go. Yes, I have all my ingredients. We're ready to rock with this mixer. And don't be afraid of dough. Dough doesn't bite. So here's what we'll be working with to make the puzzone. I'm ready to go. Let's get this party started. So what we're going to do next is roll out the dough. I like to be rolling in the dough, but we're going to roll out the dough instead. So let's go ahead and get started here with that. So again, you see me using the parchment paper all the time. Love this stuff. It's basically unbleached, ready to go. It's just going to make life a lot easier on your rolling pin. You don't need to coat it or anything, which is a lot easier. But I swear I should buy that by the gross ton. So the pizzones, this basically makes two big pizzones. I'm going to take half of the dough and roll it out. Half of the other dough will be for the other pizzone that we're going to make in just a little bit. So you want to do, you're not making a pie crust, you're kind of making a long oval shape. So we're going to try to make a shape where I'm going to basically roll this over with all the yummy fillings. And so any combination or variation thereof. This sauce, just real simple, is organic crushed tomatoes. I've added a little bit of salt and pepper and herbs de Provence in that as well, which I love. I like extra fresh basil. That's always yummy to have on your puzzone. And thank you, this turned out fantastic. So we're just basically building it the way that we want to eat it. Of course, my favorite rice-free, organic, dairy-free, soy-free cheese. It's going to pop out the sides.
Okay.
I'm not afraid of popping out the sides. So that's the beauty of the parchment paper. Once you're done, flip it over and peel it back. So I'm just taking a fork now and going around the edges. It looks so pretty.
It looks really nice.
So for 400 degrees, we're going to go for about 25 minutes. You want it golden brown. And because we cooked everything pretty much already, you're not worried about not having everything fully cooked. So look how cute those look.
Looks great.
Like those 4 happy people right there. This weighs a ton. So let's go to the magic oven. Pull out our finished product. And voila!
Good.
Oh my gosh,
looks
this
beautiful.
is so yummy. There's nothing better than a little Jeff Ackerman pizzone.
Yeah.
And this is going to be nuclear hot, but we'll go ahead and cut it open so you can. Oh my gosh, this is going to taste so good
That
later
looks
on for
great.
your kids.
Yum.
Feedback, keep it coming. Thank you for helping, Jen.
Thank you for having me.
And thank you for joining us. Come back to Autism Live. We'll keep doing allergy-friendly cooking classes. If you have any suggestions or things that you would like to see us make, bring it on. You can reach us at autismlive@gmail.com or Facebook.
Love the Facebook.
I know, too much for me. Facebook, so facebook.com/autismlive, or thousands of taco recipes ready to go. Basically go to Tacanow, TACANOW.org, and we'll see you next time.
You say howdy, we say hi. Let's get rowdy, let's get wild. Let's get.
And we're back with Let's Talk Autism with Shannon and Nancy. And joining us now via Skype, we have Ryan Judd from the Rhythm Tree. And Ryan is a board-certified music therapist in New Hampshire. He specializes in working with people with special needs. He's done it for more than 14 years. His mission is to help individuals with special needs reach their potential and developmental goals and improve their quality of life. Welcome, Ryan.
Thank you.
Good to have you with us today.
We're thrilled to have you here.
Yeah, and you're coming to us from New Hampshire, and you offer music therapy services in New Hampshire and northern Massachusetts. Is that correct?
That's right. You've done your homework.
Okay.
We did.
And we want to start, Ryan, with just, if you could tell us, because some people really don't know, what is music therapy?
So I want you to imagine intentionally using music to help a child with autism connect and communicate with his peers, make eye contact, smile, and laugh with his or her peers as they're sitting around a gathering drum, all making music together.
I think what an incredible image you've given us, because I think you've hit on a couple of things that a lot of autism parents are concerned about, working on social skills, working on eye contact, and the child feeling joy in interacting with other people.
Yeah.
So tell us a little bit about what kinds of clients you interact with, Ryan. Like, what is the right age for somebody to do music therapy?
That's a great question. So I work with kids as young as, I even worked with a little beautiful girl with Down syndrome who was 8 months old one time. That was the youngest I've ever had. And we were just working on her vocalizing. She was learning, she was delayed in her babbling. So anytime she would make a vocalization, I'd figure out what pitch, what note she was vocalizing on, and I'd reflect that through my guitar playing and my singing back to her, and we just got this beautiful back and forth, and it really helped encourage her vocalize more. So I'm going to say I started 8 months, and I go up into adults, and most of my clients have autism, are on the spectrum, and probably most of my clients are between the ages of 4 and 16.
Okay, and it sounds like your sessions are very individualized. Can you tell us what one of your therapy sessions might look like with a child with autism?
Definitely. So I usually start with a sensory activity. I've learned over the years that if you're going to work on developmental and therapeutic goals that are challenging for the client, you gotta focus on that sensory piece first. You have to make sure they have some sense of sensory regulation, that they're feeling grounded. So I always have some calming music at 60 beats per minute, which is the resting heart rate. I always have that music playing as they come in, and we might do something as simple as just blowing bubbles while listening to the music and really having them get settled down. I use very little language in the beginning, especially with my clients who are nonverbal. I don't want to overwhelm them by just talking at them and, oh, okay, now we're going to do this and now we're going to do this. I want to keep things really mellow so they feel safe and comfortable. Once they've reached that sense of regulation, then we start moving into goals. We'll do a little greeting song or a hello song where they're focusing on just a quick glance of eye contact and a wave hi, or maybe saying hi, or maybe using their electronic AAC device to touch an icon that says hello. So we're working on some of those social skills and communication through that. And then after that, just various musical activities that are tailored to their specific needs and their specific goals. But definitely focusing on a lot of speech communication goals, social skill development, as well as even some fine motor, gross motor skill development, and even some academic goals.
Yeah, I was reading that you use music therapy to teach some school subjects better. How would you do that? Give us an example.
Definitely. So if a child is working on a specific academic skill, maybe it's memorizing something. Maybe it's memorizing certain sounds of some letters. Maybe they're working on phonetics, or maybe they're just simply working on their ABCs. Well, there you go. We all know that example. A, B, C, D, E, F, G, right? We learn the alphabet through music. So what I do is I take any other academic information and I'll create a song out of it. And I also do this with safety information too. I might create a song about someone's phone number or address. And this is depending on the client. If they're verbal, we're going to really work on that those things. If they're nonverbal, we're going to be really focusing more on the speech communication and more practical goals rather than a lot of the academic stuff. Does that make sense?
Yeah,
Makes total
a lot
sense.
of sense.
We're going to need to take a break in a second, but Ryan, before we go to break, we want to talk a little bit about your website because it's a wealth of information. In particular, you have a free video series on your website, which are the 10 great ways you can use music to help individuals with special needs. So tell our viewers at home, what is your website?
It's therhythmtree.com.
Okay, so they can go there, and when we come back, we're going to talk about that free video series, and you also have some DVDs and CDs that are available that people can be using, and we're also going to be asking you about how you deal with when a child or a client, because they're not always children, is having a difficult time and getting distressed or having trouble being focused during a session, how you circumvent that so that you can get back to the work, because I know a lot of parents are concerned, oh, well, I don't know if my child would sit through this, and you've got some great answers for them. So we're going to take a break and be back with Ryan after these messages.
What is autism? What is autism?
What is autism?
What is autism?
What is autism?
What is autism?
I've been asking myself that for a very, very long time.
Let me think about that one.
Trying to just
Jeez. Let me think. Oh man, that's a rough one. Yes.
Autism is a neurological disorder that affects many of our kids in different ways.
It's a learning disability that affects the cognitive functions of the brain.
A lot of people have the misconception that it's a disability, and it's really not.
I look at it as like a special gift.
When one person thinks differently from another.
It's an opportunity for everyone to learn to understand someone that's a little different than them. Autism is the ability to educate.
They're given so much talent in different areas.
To me, autism means a chance to be with and be around people you really care about. Autism is beautiful.
It's a way of seeing the world differently.
It's always unique, totally intelligent, and sometimes mysterious.
Happiness that comes out of my son's hard work.
It's a movement.
Unpredictable.
That's right.
Awesome. Love.
The field I want to work in.
Laughter, fun, joy. Autism is beautiful to me.
I want you to remember these 3 words. There is hope.
Welcome back. We have Ryan Judd with us via Skype.
From the Rhythm Tree.
Yes.
He's coming to us from New Hampshire, and he is very well known for his work with children on the autism spectrum with music therapy. And we've been having a discussion about how music therapy works, and we encourage you to go to Ryan's website. Ryan, tell us that website again.
www.therhythmtree.com.
And you have some award-winning DVDs that are available for parents on that website. Can you tell us what those are about?
Definitely. Well, it's so interesting because I used to live in Boulder, Colorado, but about 7 years ago, my wife and I moved out to New Hampshire. And what it made me realize was there's so many families who geographically live in places like northern New Hampshire where there is no access to a music therapist. And I just thought, okay, what's the best thing I can put together for a parent or a therapist or educator who wants to learn how to use some music to help children with special needs work on there and practice their developmental goals in a home-based setting or maybe in a school-based setting. So I went all out. I hired a film crew. I put together this cool DVD of me and 5 kids, 3 of whom have special needs. And we did this all-day marathon shoot. It was unbelievable. And we just went through lots of my therapy songs. And I have all these big dramatic pauses. So if a child's watching at home with their parent, they get the space and the time to fill in greetings or words or doing some sign language or using their electronic AAC device. So there's so many opportunities for motor development, speech communication, and social skill development, all within these fun songs. And then it comes with a CD and then 3 sets of percussive instruments so the whole family can play along. It's really cool.
And they've won multiple awards, so people can be confident that they're going to get something that's really very fun and exciting. Now, Ryan, I mentioned before the break that sometimes, an autism parent hears about these kinds of therapies and it sounds so great.
Right.
Like, we want to start this, but there's fear in our hearts that our kids aren't going to be able to do it, that they won't be able to sit still, that they're, what if they have a meltdown while they're doing therapy with you? This is all stuff that you're used to. What kinds of things how do you handle it?
So I touched upon this a little bit before, but first of all, I like to just zip it. I like to just shut up and really be present with the child without talking at them. Again, especially when working with kids who are nonverbal, I feel like they get bombarded by language and words all day long. And if they're going into a fight, flight, or freeze state, the last thing that's really going to help them out is talking. So immediately I let the music speak, and I play gentle, soft music. I might do even some deep pressure via body percussion. I find that that's actually been really effective. I've got amazing video on my video blog too about that, with a child who's going into a meltdown, and all of a sudden I take these really soft drum mallets and I start drumming on my legs and then drumming on his legs, and he's getting the rhythm and the deep pressure and the connection and contact, and it pulled him right out of that state. And then we were back working on those speech and communication goals. So it all depends on the child, obviously, but I find a combination of not talking and playing calming music and doing sensory-based activities that might involve something like deep pressure work really works wonderfully.
That sounds like something we could all do with our children and learn from that experience you've had. Is it something, are parents oftentimes able to transfer some of the skills that their children learn and some of the methods you teach and do them at home?
Oh, definitely. And that's the heart and soul of my video blog too. I was like, okay, I want to give people who are non-musicians great tools that they can easily learn. All my songs, everything that I teach people, it's super easy to remember, super easy to use. I keep it really basic, and I show it. I don't just say it, I show it. So what I think is really cool about a lot of these videos is you can see me doing it. I think that helps a lot of people learn. I think in general, most of us really like a visual representation of what we're trying to learn. So that seems to be very helpful for people as well.
Well, Ryan, we think you do incredible work.
Yeah, absolutely. And once again, people can reach you at
therhythmtree.com.
And if they go there, they can get that video blog series that you were talking about, the 10 great ways you can use music to help individuals with special needs. Correct?
Yeah, definitely. I mean, my video blog is just on there. It's open. There's like 11 pages of videos. There's so much there. But if people want even more and they sign up for my newsletter, they get some exclusive videos that are emailed to them. They'll get a 5-minute video every 3 or 4 days that touches upon a fun song or activity for speech and communication, transitions, anxiety, social skill development, gross motor development, all sorts of great stuff for them.
Wonderful.
It's a great site. I checked it out, and I highly recommend it to parents out there for their children. And Ryan, you have such passion for your work. We really salute you for the work you do with our special kids, and are so happy that you're working in this field. And thank you for joining us today.
Oh, thank you. It's been an honor.
Thanks, Ryan. Bye-bye.
Bye now.
Wonderful young professional.
Yeah.
I love that on this show we get to showcase all of the wonderful things that are out there, because there aren't enough resources often enough, but you uncover these little gems and these jewels.
And nice to see somebody like Ryan in New Hampshire, which Exeter, New Hampshire, he said, right on the borderline of New Hampshire, Massachusetts, really doing this state-of-the-art work with music therapy with our kids on the spectrum and making it available to people everywhere through his site. And I do believe that the arts just work wonders with our children. And a lot of people maybe that haven't explored either music therapy or drama or art therapy.
Yeah.
This is something you might think about, and really explore, because it could unlock a whole world for your child as well.
Absolutely. Well, we thank Ryan for being with us. We're going to take a break, and we're going to be back with more Autism Live after these messages.
When When you find out you're having a boy, you always think like, oh, he's gonna play football, he's gonna do this and that. And then when he's diagnosed, all those things get washed away.
It's like that piece that's always in the back of your mind, you know, where is he, what is he doing, is he safe?
We really didn't know what we were dealing with. I wish that they could have directed me a little bit more and provided me some information.
I was a young mom. I didn't know what it was like to raise a boy, despite a boy with autism.
Hundreds of thousands of families are not getting the help they need for their children with autism all around the country. ACT Today is determined to bridge the gap. These families really have to go through a lot to get a grant. The application process isn't easy. The records, the diagnosis proof, they're really battling for their kids. So when we can give them a grant, it is so wonderful to see that they succeed in getting that help for their children. Our founder, Dr. Doreen Graham-Pichet, is an amazing woman, and she is one of the world's foremost authority on behavior of children with autism. She's extremely knowledgeable, and she oversees every single grant we give. She is part of that process. People may think of autism care and treatment as simply schooling or therapy, but you know, we provide important safety supports, things like fencing, for example. The whole family's living in fear of that child running out into traffic. I recently delivered an iPad to a little boy with some of the apps that are out there for children with autism. Miracles happen.
I got the iPad from ACT.
From ACT,
What
yes.
did it say? Can you repeat that, Dustin?
I got the iPad from ACT.
We have helped so many military families, and when I think of these brave families that are fighting two battles, one to protect our country and one for the right treatment and care for their children, it breaks my heart, and I think we have to do more as a nation to help them.
There's not a day that doesn't go by that we don't think about it. Some people say, oh, he's normal. You don't see the battles that I see every single day. My husband does have to deploy, and when they get on that bus, that might be the last time that my kids ever see them.
So I called, and they informed me that he had received the grant, which was like a blessing from above. I was just like speechless. I just started to cry because, you know, without it, we would have been lost.
The ACT grant was a total miracle, and without that, we wouldn't be able to receive the service dog. So we're so appreciative what they've done for us as a family.
Recently, ACT Today funded a program for military children with autism in San Diego, the Inclusion Films program, which is run by Joey Travolta, and teaches kids on the autism spectrum literal filmmaking skills. They learn how to make a movie.
Are we ready? There you go, got it. Okay. Everything that goes into the process of making a film goes into everyday life. So they're learning life skills, they're learning to collaborate.
It was really nice to know how much they were enjoying this camp, and they're with people who are supporting them and are making them feel great about themselves and their differences and their similarities. And I get two kids that are working together and apart and together and apart, so it's an interrelationship as well as a camp and a learning experience.
It's so fulfilling when I get letters. One stands out for me, a boy who was 14 with Asperger's, and we gave him a grant to go to a drama camp. He wrote to us and said, "Dear ACT Today, thank you for letting me belong for the first time in my life." These kids are remarkable. You know, we underestimate them. They're so knowledgeable, they're so capable, and we can change the life of a family, which means changing the life of a community.
Welcome back to Let's Talk Autism with Shannon and Nancy. I was saying to Nancy, because we didn't do the show yesterday, it was one of the things that was on our schedule yesterday for me to do my recap of going to Dodger Night, Autism Awareness Night at Dodger Stadium. And I will say this. First of all, I have to say thank you to Autism Speaks and to Jennifer Jones for being so amazing and inviting us to go and to participate. We have participated before in different ways. It was much. I will be honest, I was like, about the whole thing because we've been before, and my son didn't access it. And I was just saying to you during the break, I forget how important it is when our kids find the way to access something, how it changes them, it changes us, it changes the world. So they do this yearly, and next year you've got to go.
Okay.
Because
what happens there?
Okay, so you go to the Dodger night, and there are other things that are happening there too. It's not just autism awareness, but they have a pre-game ceremony, and kids whose families have sold a certain number of tickets are invited to come down to the field. We've done that before, and they pan the camera by. The kids all stand there. They get to meet some of the players. They pan the camera by. The kids are on the Jumbotron, and they think it's really cool. They introduce some of the dignitaries from Autism Speaks and recognize them, and everybody applauds, and it's wonderful, and that's lovely, and that's fabulous. And as I said, we've done that before. But they do choose certain kids, 9 kids, to go on the field aside from this with their parents, that when it's time and they call the lineup for the Dodgers and then the Dodgers run out onto the field, that the kids get to run out on the field with an assigned player. They get to run to where that player is at their position. They're given a baseball and a pen that they run to the player, give it to the player, and the player signs it for them, and then they run back to the stand, and the whole crowd cheers like crazy.
That's
now,
amazing.
I've been there for that before and cheered the
Yes.
kids and thought, okay, that's really
Wyatt
lovely.
would have loved that.
I will say this, it's a hard gig for the kids with autism because there's a lot of standing and waiting and filling out papers for the parents, and then finally it all culminates in one thing that literally is less than a minute.
Right.
And kids frequently have meltdowns before, during, and after because it's hard.
Hard for
and
them
it's a
to
big
wait
sensory
and,
thing.
Yeah. And a lot of pressure on them for what they have to do.
Yes, and they have to remember, and they're reminded 1,000 times. The parents are feeling pressure. My kid was one of the older kids that was, Spencer was there and ran out onto the field. Spencer, who we're going to have on the show, who's a wonderful singer.
Right.
And there were, 8 other kids that were there. One who didn't make it out onto the field because it was too much.
Right.
And it was this moment for all the parents of loss when his parents decided this is too much for him.
Yeah.
It was a real loss. We all felt the gratitude of that we're not in this space right now, but our hearts bled for and I mean within minutes they waited the whole thing, and he couldn't hang, and we felt so bad, but everybody got it and understood. I've never been so grateful for how well my child was. I had such a good time with him in the whole period of time leading up to it, but he was revved. There is a video on our Facebook so that you can see exactly what I'm talking about. We were waiting, and they said the lineup, and there was a guy there who was saying, now remember, Jem had the longest legs, so he was going to run all the way to center field. And they broke the news to me that I was going to run with him to center field.
That must have made you just very happy.
I was like, get me a walker and and a crew who can restart my heart, because I don't know that I can make it, right? I'm not a runner. But anyway, all the kids were waiting, and there was just the one person. He's like, you remember, you know where you're going. The little girl who was next to us was crying because she wasn't, and I had said to that dad, you're going to be okay? He's like, I don't know, right? And then they said, now. But the minute that they said now, a bunch of people stood in front because they were all taking pictures of the kids starting to run. So you've told them, run, 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 like there's nobody's business. And especially to Jem, they were like, you got to run all the way to center field, get that autograph, and then run back because there's only a minute. And you've got to run really fast. Now, my child, black and white, you give him a job, he's going to do it. So they said, run, and then they stepped in front of us. And you can hear me on the video screaming, don't run them down.
Yeah.
So then he clears the media and he starts to run, and I'm running after him. But all the players were coming this way, and Jem was going this way, and there was a moment of sheer madness where I thought my son was going to take out 3 of the Dodgers. What I didn't,
would take him out.
Well, no, he was running and just going to plow through them to get to center field. What I didn't realize is, as I'm screaming, don't hit the players, I almost took out the catcher because he was running this way and I was running this way. You can see it on the video. He did kind of bump into the cameraman who was following the right fielder. But then he ran out. I was so far behind, screaming. By the time I got out to center field, he had already met with the player. The player had signed the baseball. Jem was already leaving. I'm thanking the player. And you see, I pan, I'm so excited that we haven't killed anybody. And I pan and I said, we got to run this way. And I turn back and you see all of Dodger Stadium. And I think in that moment on the video, you get I literally was like, holy moly, where am I?
Yeah.
It was so, I've stood on the field before, but until you've stood in center field and turn and see all
how huge it is and all the people.
Took my breath away, and they were all cheering for our kids.
Our kids and your kid.
And it took my breath away.
I saw the stills of Jem on Facebook, but I didn't see the videos yet.
It took my breath away, and that was a big deal, right? But the difference in him afterwards, I'd taken him to baseball before. My dad was a baseball player. My dad coached the Budweiser Bells, professional women's softball. I mean, baseball was a part of our lives.
Yeah.
And my kid has not been interested, and I didn't think he would stay and watch any of the game. We stayed and watched. The player that he met was Jock Peterson. He's a new player on the Dodgers, but the up-and-coming star. He hit a home run that night.
How cool is that?
My son was so excited. He was asking me questions and looking at the scoreboard saying, what is RBI, Mom?
Okay.
And I explained it to him, and then later on, he was like, now how do I say where it is in the inning? He wanted to get the whole lingo about we're in the bottom of the fifth.
Right.
He kept asking me questions.
So he's really understanding it.
But only because he had an access point.
Right.
And we've stood on the field before, but the fact that he met that young man, it made a difference.
Yeah.
We can never discount what can happen.
Key to unlock, what that key is going to be that unlocks it. Because, you know, Wyatt's been playing baseball now on the Agora Pony League, which is a special needs team, and he loves going to play baseball, but watching it is a whole different thing. He doesn't really understand. He understands running the bases and home and getting a run.
Yeah.
But he doesn't really understand the rules and doesn't want to take the time to learn them. And
that's always been Jem.
His dad gets frustrated, you know. So maybe something like that
next year,
you know, next year, or even just taking him to the Dodgers game and giving him the excitement. And Eddie Guardado is on our board, and he's the bullpen coach for the Minnesota Twins this year. He used to be, you know, he's played Rangers, A's, all these teams. And so I'm hoping that maybe Wyatt could get down when the Twins come.
Yeah.
Maybe he could get down in the bullpen and, you know, experience that.
Jem was asking so many questions. At one point, he was like, what's that area over there? And it was the bullpens.
Yeah.
And then we had to walk all the way around to where because we could see, it was the Arizona Diamondbacks. We could see them in the bullpen, but where we were sitting, you couldn't really see the Dodger one. So we walked the length of the stadium so that we could look over the edge at the Dodger one. He was like, I want to see the Dodger bullpen. I have never seen I felt such a closeness to my dad. I mean, it's emotional for me because I said my father would be so
proud
excited.
and so excited to be there. Well, he
was
there.
He was there, I
he
think.
Was there.
But it reminded me of a couple of things that we can't give up on our kids. We have to find the way for them to access, and for them, sometimes that takes more than we could imagine.
Yes.
But it also reminded me, too, I was a little sad that nobody was with us. My husband couldn't come. He was very sad about it. Nobody was with us. We didn't have any, I mean, the other autism parents who I know, but we had nobody that was there just for us. But what it did for me was that everything when we got there was about just me and him. I didn't have any other distractions. I knew that we were there for a while, and I was calm and centered, just exactly what Ryan was talking about. I wasn't on him about 38 other things.
Which I tend to do way too much.
And I had such a good time with my child.
Right. I think sometimes, and you once said to me, when you're getting too much blowback, try positive reinforcement as opposed to praise.
It's praise.
And I forget that. And sometimes I feel like all I do is, now you're not allowed to do that here. When do we do that? And we're not supposed to do that. And and I'm not enough of great job on.
Yeah.
And just being.
Just
Wyatt
being.
constantly says to me, Mommy, I don't want you to do your work because I'll have my iPhone.
Yeah.
He'll say, Mom, please put your iPhone away.
Yeah.
And
I said to you that my kid says to me, don't you have something you want to do on your phone? Because if
So
I'm
he
on
can-
my phone, he can be on his phone,
right.
and he wants to tune me out.
Right.
But, you know, I will say this, that while we were waiting and all the kids were having a hard time, all of them were having a hard time at different levels. And, you know, he was saying, can I play on my phone? Can I play on my phone? And I really wanted him to experience it. And I said, I need you to do a good job on the field.
Yeah.
You do a good job on the field, and I'm going to let you play on your phone for a little bit. And the deal that I worked with him was while the Dodgers were up, there could be no phone. But while they were out in the field, he could be on his phone. And I was feeling kind of bad about that. But what happened was whenever something happened, he would put the phone away and go, what's happening? What's happening? So by the end, the phone was away.
Great.
And I would never have guessed that that
Great.
was possible.
Great.
He got more excited about the thing.
Mm-hmm.
So important that we find these opportunities for our kids. I said to somebody, I unapologetically, whenever there is an opportunity for my kid to do something because he has autism, I am there with elbows going, where do I sign up? You know, we did Surfers Healing.
Yes, which we've done 3 times, and Wyatt loved it.
It's so important, I think, for families to access whatever you can, wherever you are. Look, there's enough times that they don't get an advantage, and if there's something that they get to do, his little friends are like, why did you get to go on the field?
I can imagine.
And I'm
he's
like,
a hero.
because he's fabulous. And our kids need that swag.
They do.
They do.
They do.
All right, so we're going to take a short break, and then we're going to be back to close out the show. Stick with us. Hi, I'm Shannon Penrod, and we're at the ABCs and XYZs of Special Needs Conference. And this year, for the first time, they've got something really remarkable. It's the Entrepreneurial Boutique. These are all items that have been made and are being sold by individuals who have special needs. So we're going to do a little shopping and talk to some of these fabulous entrepreneurs. Come on.
My name is Molly Rarick, and I'm founder of Breed's Gift. We're a nonprofit that serves teens and adults with special needs, like Chase here. We were founded in 2013 and serve people in the Conejo Valley, Santa Barbara, and LA.
Our main objective is to give our participants the skills they need to gain a more independent life.
My name is Shelley Cox, and Lisa Zalagi and I are founders of Creative Steps and Create Micro Business Enterprises. And the items that we're selling here today are all made by the clients who have passions about what they want to make, and then they get the profits from what they make after we've paid all of the other expenses.
We are here today because my goal is to be independent, and also I would like to share all my artwork, and I would like to sell.
Thinking about at his young age being a businessman, you know, it's amazing. I cannot be more proud.
Welcome back to Let's Talk Autism with Shannon and Nancy. Nancy and I are here at the end of the show. I have a very exciting show tomorrow, really shaping up to be an amazing show. First of all, we have our guest that we didn't have on Tuesday, Tom Bowes. He refers to himself as the autism expert. The autistic expert. He, young gentleman, again from England. We're over the pond this week. We're very British this week.
And there's a new royal baby.
There is a new royal baby. So he's going to be joining us. He has a series of videos. You've got to check these out, Nancy. They're really fun. Is he on the spectrum? He is on the spectrum. He has a diagnosis of Asperger's back when you could get that diagnosis.
Okay.
And he does a series of lovely videos that are short and sweet and to the point, where he explains different aspects of autism to viewers and in a wonderful way. So very excited to have him on the show, and appreciate the fact that he was willing to postpone because I thought I had pink eye. So he'll be here tomorrow via Skype with us. Then we also have 2 gentlemen who are going to be joining us, the co-writers, co-producers, co-directors of a new film that's going to be making its debut next week in New York called Burning Down. This is a feature film, and you will hear about it though, because the main character, and one of the gentlemen who's going to be with us, Christopher, plays the main character. He is a fireman who is a very proud New York City fireman, and he gets married, has a child. You think it's going to be all that happy story, but his child ends up being on the autism spectrum. You get to see what happens to the family and how it culminates with him having to find himself because his child is lost, literally and figuratively.
Okay.
And so, beautiful
Sounds
film.
Very interesting movie.
So we're going to have those two gentlemen with us, Tom Warday and Christopher, whose name I cannot remember in this moment. I apologize to Christopher. But they're going to be with us tomorrow via Skype so that we can talk about this wonderful movie, Burning Down. But then in the second hour, that's just the first hour, we are debuting The Future is Bright, a new show here on Autism Live with Stephanie Schaefer is the host of it, and Scott Badish, who is the president of Autism Society of America, is on the show. We filmed this on Monday, and it is brought to you in conjunction with the Autism Society of America. This is our ongoing effort. We have a show now talking with Taka, with Lisa Ackerman. Autism Speaks is starting theirs as well, which will be On the Spectrum with Matt Asner, and this is The Future is Bright with Autism Society of America. We're out of time.
Going on.
It is. There's a lot, so I don't want
exciting.
anybody to miss this tomorrow. It's going to be a great show. Until then, are we out of time, Kelby? We have 15 seconds.
Oh,
so until
okay.
then, give your kiddos a hug from me.
And give yourselves a hug from me.
And happy Mother's Day if we don't get to see you tomorrow.
Yes, happy Mother's Day, yeah.
Which is this Sunday.
That's
and
right.
somebody has a birthday next week, which we'll talk about next week.
All right.
Bye-bye for now.
Bye-bye.